This is Core Conversations with Natalie Baggio.
Welcome back to Core Conversations. I'm joined today with Dr. Tom Birris, a gastroenterologist here in Southwest Michigan. And today our topic is digestive health. Welcome to the podcast.
Thanks for having me.
Yeah, thank you for being here. Before we get into the medicine side, I would really enjoy for you to spend a few minutes and tell the community about yourself and how long you've lived in Southwest Michigan.
Yeah, I'm originally from the Pittsburgh area. I have been in Southwest Michigan now for almost 14 years. My wife is from this area, and that's kind of what led us here when I finished my training in gastroenterology at Loyola University outside of Chicago in 2012. And so we were looking at places we might end up. There was an outstanding opportunity here for me. The Marie Yeager Cancer Center was opening around that time, and my wife is a health psychologist with interest in a field called behavioral oncology.
Yeah.
And so she slid right into a position there, and I joined what was then Great Lakes Gastroenterology, and we've been here ever since.
That's great. We're fortunate to have both of you here serving in our community. What's one thing that you love to do when you're not working and helping patients?
I would say time with friends and family, outdoors if possible, especially this wonderful time of year in Southwest Michigan that we're entering into here.
Yeah, great. It is beautiful here. Being out on the beaches, the water, the golf courses, it's a really beautiful place in the summer here in Southwest Michigan. So let's talk about digestive health. There's several topics that have been coming up that I think would be really great for our listeners to have more information around. Do you want to start? Let's start with preventative screenings.
Sure.
That's really important. We know that the health and wellness of our communities starts with preventative screening, and colon cancer has been on a rise, and I'd love for you to share your perspective.
Sure. One of the most common things we do in gastroenterology is colorectal cancer screening. It's one of the most effective cancer screenings we have amongst all the different types of cancer we screen for in other fields. The current recommendations are for screening what we call average risk patients, those without family history or other medical issues that put them at higher risk, beginning at age 45 up through 75 and sometimes longer in certain situations.
Okay. What are some different ways for people to think about preventative screening?
Yeah, there's a growing number of options, which is nice to increase the numbers for screening to get people out there. You hear a lot about colonoscopy. That's often considered the gold standard.
I hear from patients, though, that sometimes there's fear around a colonoscopy.
There's a lot to colonoscopy. There is the bowel prep portion. There have been some improvements in that regard with different options there as well.
I've heard from patients that taking the pills pre-prep is one of the ways that it's more, I don't want to say digestible, but an easier access point to the procedure,
there is
I guess.
A prep that's been available over the last few years now that's a series of pills that is great for some folks. And so I think often that's the part that people say was their least favorite part of the experience, but it is improving.
Good.
Once you get to the day of procedure, patients are usually pleasantly surprised with how easy it is. They have a nice nap. They're shocked when they're in the post-op room, having heard that the procedure's already finished, and they're kind of wheeling out to complete the rest of their day.
Yeah, I've had many patients say that they were pleasantly surprised on how quick the procedure went, how painless it was, and how they could just resume their daily routine in the same day.
Yep. Yeah. You get a free pass from stuff for the rest of that day. Take it easy, but back to your normal self the next day for sure.
So what are some of the trends that we're seeing in the industry around colon cancer?
Yeah, so one of the reasons for the big push, and 45 may sound like a younger age to folks than what they'd heard previously, is because there is this growing body of data showing younger age of onset of colon cancer in a lot of instances. And we're seeing that locally across the country, around the world. And unfortunately, these younger folks are being diagnosed are often at more advanced stages. And so I think the two take-home points in that regard are, one, even if a patient is not having symptoms, he or she should try to keep up with screening when they are of age. And the other piece of that is that regardless of a patient's age, if he or she is experiencing symptoms, especially symptoms that we would consider alarm symptoms, rectal bleeding, changes in their bowel habits, new or different symptoms later in life, these are things that we should investigate more promptly and thoroughly.
So you would advise on if anything feels abnormal and is sustained abnormal signs or symptoms to reach out to your physician immediately.
For sure.
Yeah, that's good. Why do you really enjoy being a gastroenterologist?
That's a great question. I fell in love with gastroenterology as a third-year medical student. I found myself interested in the types of problems that were being referred to gastroenterologists: abdominal pain, gastrointestinal bleeding. I loved the procedural aspect, and I continue to love those and all aspects of gastroenterology. I also love teaching gastroenterology. I've been involved with our residents increasingly over the years, and that's been a great way to keep me energized and fresh and up to date.
So I've heard you have a new partner that'll be joining your group soon.
Yes. Colin Westman is a graduate of our local internal medicine residency program who is completing a gastroenterology fellowship in New Jersey. He's going to be doing an additional year of training coming up starting in July in advanced endoscopy procedures, and then will be joining us sometime in the second half of 2027. So we're very excited about that.
Yeah, that's really wonderful. And it's great to hear that people who come here and start in our residency programs have a drawback to Southwest Michigan. Our most recent graduating class of residents, we retained 32% of them. So we have a really great retention rate on when people come to Southwest Michigan and experience it, they love it and want to stay. You know, online, there's a lot of discussion around health, around digestive cleanses and probiotics, and just kind of curious from your opinion, what do you think about those trends?
Yeah, they're certainly big industries. In a lot of cases, they aren't things that have been very well studied and are difficult to study. So there's not great data supporting certain cleanses or certain probiotics. I think at the end of the day, when it comes to preventative digestive health, it's really best to double down on the things we kind of already know we should be doing anyway. Fresh fruits and vegetables, whole grains, minimizing red meats and ultra-processed foods, minimizing alcohol as much as possible.
So sticking to the basics.
I think that's a great way to start.
Whole foods, and you'll have probably the best results from that. And what about exercise?
100%.
Okay.
Yes, that's a great point.
All right. That's great. I think that's really good and helpful information for our listeners. And it's been a great experience having you here today on the podcast.
Thanks for having me.
Is there anything else you'd want to share before we close out?
The gastroenterology team is here for everything beyond colorectal cancer screening as well. We take care of the entire gastrointestinal tract, from the esophagus to the stomach, to the intestines, to the liver, to the pancreas. And so everything from gastroesophageal reflux disease to IBS to cirrhosis of the liver are things that we can help manage if folks are having trouble or not getting to where they hope they might be with their initial steps to manage those things.
Well, we appreciate you and your partners for being here and serving Southwest Michigan.
Happy to be here.
Thanks for joining Core Conversations. We'll see you next week.